Hi, Aaliyah. Dr. Aaliyah, how are you?
Oh, I'm well. Thanks for having me.
I am so excited. Thanks for being on this episode of Tisha Talks. I'm so excited to have you on here because I have tons of questions um, about this topic that we're covering. Because for the month of April, we're really here at Tisha Talks focusing on our health and investing in ourselves and just making sure that we're living the best quality of life that we possibly could live. And so I'm grateful that you have agreed to come on and just share some of your expertise with us and talk to us more about, your journey as a physical therapist. And I'm so excited about that. So let me stop talking and give you the opportunity to introduce yourself to our audience, to anyone that is watching. If you could just tell us a little bit more about yourself, tell us about what you do, tell us why you do it, just tell us everything about you.
All right. Well, very short introduction. I am Dr. Rashid Washington, a physical therapist. I own Art Technique Physical Therapy and Sports Performance in Roselle, New Jersey. And simple enough, I do what I do because it works for other people. It helps people to get better. I always wanted to be in the medical field, but I found out in an early age that I didn't do blood well, other people's or my own. So physical therapy worked right away for me. I was in therapy myself for about a year and a half before and after surgery. And physical therapy helps people get better. You're using movement and postural correction to help you get better, to alleviate whatever ailments going on without the use of medication, unless, of course, you've had surgery and just need some pain meds. But generally, just using your body's own self to get better.
Right. I absolutely love that. I have actually been a patient. And so I love the fact that physical therapy offers another option beyond the medicine. And so can you tell us, well, before we start talking about that, I know you said that a part of your journey, you started out wanting to be a doctor until you realized that this whole blood thing was not for you. What is it about, I guess it's really helping, right? Because doctors are in the profession of helping people feel better. What is it about that you just gravitate to so much?
I'm gonna be honest, I'm not really sure. I like to help people. I just like to help people get better. People are in so much pain, particularly when it comes, there's back pain, knee pain. They lift something wrong. You're just out, that weekend warrior mentality. Like, oh, I'm going to go run 3 miles today. And I haven't done it in 6 months. And you just wake up and, oh, my knee hurts. Like, well, let me help you get back to doing what you love to do. Get back to doing something that's benefiting your body and something you just enjoy. And I don't know, helping people just always been my thing. I like to help people.
Well, thank you for helping us, helping me. Yes. Helping me. And it's so funny because my first experience so I have, I think, like 2 herniated discs. And my first experience with it was in my 20s. And so a lot of times when people think physical therapy, they think older people, like it's always somebody older or athletes. And here I was like 23, 24 with these herniated discs, had to have surgery and the whole 9. And that like shocked me personally that I would be so young dealing with these type of body issues. And so I've been in physical therapy a lot throughout the years because of this like sciatic nerve situation and the herniated disc. But I went through that process in the beginning where like I was on all kinds of drugs, not all kinds. Let me be clear. Not all kinds. The narcotics have not all kinds, but I was definitely on like that Percocet was not for me. That thing like really messed me up. And so I knew that like I didn't like the way it made me feel, but I wanted to be better. And physical therapy really helped me with that. So can you talk just a little bit about how that works? Like how you're able to like, does your body repair itself? Like what's the philosophy or things behind that, behind the physical therapy aspect?
Well, with physical therapy, particularly when it comes to back problems, whether it's herniations, bulges, just a pinched nerve, it is strictly trying to find what works for your body type. Whether it is your body prefers to go into extension, meaning going backwards, or into flexion, coming forward. It's just about restructuring or reorganizing your posture so that now your body is working for you. Some people's bodies, I mean, granted, we sit all day, everything's in front of us, our phones, our heads down, our bodies rolling forward. You know, by the end of the day, your face is on the computer screen because you think it's going to help you get through the day. And it's just one of those to help you. The thing is, okay, let's go backwards. If your herniation is coming backwards, if we move your body backwards, now things can start to slide back into place and, in essence, move back to where it's supposed to be. So this way you're getting less pain. You're getting less symptoms into the leg, whether it's tingling, numbness, burning, hot, cold sensations, waves of pain. You're getting less of that just by readjusting your posture, just by taking that moment, that extra moment of, okay, I've been sitting for 20 minutes. Now I'm like this. Let me stand up. Let me stretch. Okay, move a little bit and just kind of allow your body to get back to its anatomical position, kind of where it likes to be.
Wow. Wow. That is so that's for me. Just being able to do those stretches that you have shown me so graciously how to do. And I think also discovering that, because I think I was doing like the crunches, because the thing that I was taught about back injury is that you have to have a tight core. So automatically I was like, you know, I got to do them sit-ups. I got to do the sit-ups. But in this particular go round last year when I hurt my back, I couldn't do the sit-ups. Like I couldn't do the sit-ups and everything was hurting. And I remember I went to you and you were like, well, I guess depending upon how my herniation is, I shouldn't be going forward. I should be, it makes a difference. Like really, it makes a difference. So like understanding your body. But can we talk to a little bit about, I know that physical therapy and adjusting your body and doing certain things can also help with stuff like high blood pressure and those other elements are things that we find ourselves being challenged with. How does that work?
Absolutely. I mean, in terms of, you know, you think of like your high blood pressure. I mean, if you just a general diagnosis of obesity, just kind of being significantly overweight, diabetes, high blood pressure, high cholesterol. A lot of these things are activity or lifestyle diseases, parts of them, due to lifestyle changes. So it's kind of like, okay, you just, you know, you ate a Whopper, you had a Big Mac, you drank this, you had a milkshake. All of this is adding up. And now over time, it's kind of like, oh, I went to the doctor, they said I have high blood pressure. Well, yeah, you just took, you know, a lot of salt in your diet, high cholesterol, a lot of, you know, the fats in your diet, your obesity, just generally being overweight. Sometimes if you just make a simple lifestyle change, for a number of people, it can get you off of your medications or even reduce the amount of medications you have to take. Obviously, in terms of obesity, that visceral fat, meaning that lower abdominal fat, is a big predisposition for high blood pressure and all these other heart diseases. So simple activity changes, lifestyle changes beyond on top of changing your dietary habits will definitely start to get you feeling better. I mean, our bodies talk to us. So you feel a little less sluggish and get you just moving better. And for some people, you'll even start to shed some of those pounds.
Wow. So you said our bodies talk to us. See, you know, my husband tried to tell me that I'm crazy. So but like, no, like when the weather changes, like, I mean, sometimes I feel like an old soul because I'm like, oh, it's about to rain. Like, because my body will start aching, or like I can feel like a twinge. And when I was younger, I used to ignore it. Like I used to be like, all right, well, I'm just pop an Advil or pop an Aleve and just keep going until like I couldn't go. Because if anybody, I don't know if anyone watching has ever experienced your back going out because of like a ruptured disc or a herniated disc. That is like, you realize that your back plays a part in so many things that you do, like even laughing and coughing and everything. And so you're literally like on your back. You can't, it hurts to walk. It hurts to do so many different things. And so what it forced me to do was start paying attention, right, to the signs. So I think it's so interesting that you say that your body talks to you. Like, in what ways can your body talk to you?
Oh, absolutely. Our bodies definitely talk to us. A lot of people mistake the whole saying of no pain, no gain to mean if it doesn't hurt, it's not working. But unfortunately, that no pain, no gain does not involve ouch pain. Ouch pain is I cut myself, that hurts. My back went out, that hurts. I ran too far, my knee hurts, that hurts. As opposed to I just did 300 squats and now I can't sit, so my butt is sore. That's no pain, no gain. Yeah, keep doing it if you want to get that bigger booty. Keep doing it. You want to tone those thighs. But yeah, ouch is a different type of pain. That's a different sensation. So your body's telling you like, no, that's no good for you. Or kind of like if you're, I don't know, like I said, going back to the obesity or high blood pressure, heart disease thing, you're just starting to feel a little sluggish. You're a lot more lethargic and tired and you don't understand why. Sometimes just adding something to your day. Instead of taking that elevator, take those stairs. See if that changes just anything about how you're feeling about yourself, give you a little boost of energy, because exercise does release those endorphins that make you kind of happy and pep you up and keep you going. And like you said, yes, the weather also plays a role, because when that barometric pressure changes, when our season's going from hot to cold, it's extremely humid. Those things definitely play a role on our body, because it's pressure. It's atmospheric pressure on your body. I mean, I know for a fact my shoulder had shoulder surgery long time ago. And now to this day, if it gets too cold outside, particularly I can tell you if it's going to snow, my shoulder will start to freeze. And I'm like, yep, that storm is coming. Here comes, hurricane, whoever, or a snowstorm or whatever. But it definitely happens. Definitely.
So when our body talks to us, so we should be listening when our body talks to us and begin to do like the prepping things. Like I no longer just keep going and going and going. Mm-hmm. Like if I remember there used to be times where I would be like, I'm not going to go. Like if my back is really feeling stressed, that's what I'll call it. Like it'll feel stressed. Like I'll be like, Tisha, when I was working, like going to 9 to 5, I was like, you know what? Got to stay off my feet today. Got to relax today. How can we talk about stress? Can we talk? Because stress, like, it just causes everything to like tighten and to get like 10 times worse. Can you talk a little bit about that? The role that stress plays in our body?
Absolutely. Absolutely. Stress plays a huge role as well. I mean, it's one of those things you start the day, you're in the car, the mirror is where it is, you fixed it. All right. You leave from work, you get back in the car, you're fixing the mirror again. Well, you're the same height. So nothing else has changed, but the amount of, whether it's the pressure from the day, the stresses, everything's on your mind. And by the end of the week, your shoulders are up near your ears and everything is tense. Your body's tight. Your posture isn't correct and your body is responding inappropriately, if you will. That's also a good time or a big time for when people start to get sick. So that's when, start flooding yourself with that echinacea if you're one of those people, vitamin C, or just remembering, okay, I need to take a minute, take a beat, relax, do a couple of breathing exercises, and what I call apologize to your body. If all day you've been sitting like this, your shoulders are forward, your head is on the computer screen, pull back, do a couple of chin tucks, reset your body, and then be ready for the rest of the day. And just relax, whether it's to take a hot bath, a nice stretch, go get a massage, go to therapy, anything at all. Our technique is a matter of
fact. Yes. That is so, okay. This is so good to me right now. It is because because I've been dealing with this for a long time, that it's good to hear that the things that you're saying that we should do, I've started to do like in my little regimen. Like I noticed, like when I wake up, I'm stiff from sleeping all night or sleeping incorrectly or whatever may have, however I was laying. And and my first thing is, all right, you got to take a shower because it relaxes me and like the steam relaxes me and my body is a little bit more loose. And then I'm like, all right, I got to do the stretches because when I don't do the stretches, I'm like, coming to you. Something's wrong. Something's wrong. So I think I love that concept of your body is talking to you and are you listening to it? Right. And not just allowing life to happen, because at the end of the day, correct me if I'm wrong, it's going to ultimately affect the quality of life that you're living.
Oh, absolutely. Absolutely. I mean, I used to, particularly when I was younger, I used to run myself into the ground till I was pretty much in the hospital with exhaustion and dehydration. It's one of those like, okay, you know what? You can actually die from this. So you need to relax, have some water, take a rest break when you need to, take a day off when you need to. Lord knows I hate my days off. And just get ready, prepare yourself. Do what you need to do for your body, because we only have, YOLO, as everyone says, only live once. So you better make the most of it and make sure your body is ready to get you through the rest of it. Nobody wants to be, broken down in their mid-30s, 40s kind of thing.
Exactly. Okay, so let's talk about, first of all, this just blessing me. I don't know if it's blessed anybody else, because just listening to your body, like that is so important, and taking care of it. And you brought up another good point about the fact that we only have one, right? Like we only have one vessel, one temple, one body that we are responsible for. And so we should really be treating it well.
That's right.
Yeah. Okay. So let's talk about some of the machines that you have, because you have this machine that I love. I love a lot of things when I go to physical therapy. You have this machine where you step in it, and I'll let you tell it. I don't know the name of it, but
yes.
It really helps with like running and walking and stuff.
Yeah, so we have an Ultra G treadmill. It's an anti-gravity treadmill. What it does, so whether you are, let's say, whether you're overweight, whether you have, you just had a surgery for your knee, your ankle pain, back pain, even hip pain, etc. You step into the treadmill itself, it blows up, and it can alleviate your body weight up to 80%. So literally like you're walking on the moon. And what it does is, if it's a situation in terms of you have an injury, it allows you to get back to rehabilitating and just getting on with what you like to do. So it allows you to run faster and allows you to run longer, allows you to run earlier than you would have, say, okay, I only have access to the ground. I only have access to regular treadmills that have that constant impact on your knees, on your hips, on your back, on your entire body. Flip side, also, if someone's just kind of overweight and they have overweight and knee pain, let's say that, and your doctor tells you, oh, well, you need to lose weight, the knee pain will go away. It's kind of like, okay, well, I'll go exercise. When I exercise, it hurts my knees. Oh, well, you need to lose weight. Well, that's a cycle that's never going to end if I have no other way to get to what I need to do. So we can get you in the treadmill, alleviate body weight, 50%, 20%, 70%, whatever is necessary for that person. And now they're running like they haven't done in years before they had the extra pounds or before they had the pain or things of that sort. It also works with stroke rehab, a number of things. It's an awesome machine. Absolutely amazing.
Yeah, I love it. I've only been on it like a couple of times, so.
We'll get you back in it. Come on in.
But I like it because when I was really hurting, I still wanted to work out. Like I still felt like, I wanted to sweat, and I couldn't do that because I tried to get on the bike at the gym, and I was like, oh, this is hurting. Like I've only done this for like 5 minutes, and this is hurting me. I haven't burnt any calories. So that was really good for me. I love that machine. You also have this device that you put on the back, and it like does the vibrating and the heat. Oh, that gives me joy. Can we talk about what does that do exactly? Because I feel really good after that.
Yes, the electrical stimulation machine. Everyone loves this unit. Everyone goes, oh, it's my favorite part of therapy. I'm like, yes, you didn't like talking to me, but that's okay. So literally what it does is its job, it works on what they call the gate theory of pain. So its job is to, in essence, make your brain believe there is no pain there. So we only feel pain because of our nerves. So it scatters the nerve sense on its way to your brain, so that it is a temporary relief of pain. And then once it's off, you'll still feel that relief for maybe another 5-10 minutes. And then slowly, hopefully very slowly, you may start to get the symptoms return. Some people, particularly when it's coupled with the ice or heat, takes a little longer. But it is an amazing unit. I actually love it myself.
It is very, very good. I will say, so I have been to chiropractors. I have been to other physical therapists. I have had surgery, and I have been on medicine. And I will tell you, after going to your physical therapy training center, And even being on that thing relaxes my body. Because I think for me, I really have to be relaxed, even to be able to do the stretches. And I'm normally like very, very, like nobody I don't, when I go to the mall, I don't do the massage thing. I don't go to the spa because I can't. I've had experience where people do something and stuff is out of whack and I'm walking around like limping. But I normally don't have anybody touch my back, play those games. And when you were doing it, it felt so like, even the pulling, I don't know. So were you like aligning my feet? Like you do something with my feet?
Mm-hmm.
We're not supposed to be talking about me, but I have the experience that I've had in physical therapy as it concerns my body has been uplifting and encouraging. And it's also a really, really good feeling to not have to be popping like narcotics or medicine that ultimately has impact on your internal organs.
Absolutely.
So I just want to talk about a little bit about the techniques that you were using with me.
Oh, absolutely. In terms of with your foot and ankle, it's just about aligning from bottom up, just to see if we get you to move a little bit, see is everything aligning, are your ankles at the actual same point? Because if they're not, that means everything's works its way up the chain. You know, say if you're limping for a long time, if you're limping, eventually your knees are going to start to hurt. Once that hurts, then the hips. Once that hurts, then the back, and kind of just all the way up and down the chain. So aligning from the bottom, make sure everything is aligned. And then work from there, because there's no point in stretching or strengthening something when it's already in the wrong position. Mm-hmm. If you didn't come in that way, if that's not your normal. There are some people that are normally a little off balance, those that have scoliosis, etc. And if you're not one of those people, you'd rather be aligned before we start moving things. Otherwise, we're just kind of wasting our time and not really focusing on the root of the issue, as opposed to just treating random symptoms.
Mm-hmm. Well, guys, that aligning stuff, it brings me joy. It brings me joy. I try to do it at home, and the stretches and stuff do help, but I can't actually align myself. So I wanted to share that because that has been a transformative experience for me. And I know that a lot of people, they want to work out, they want to or maybe get back in the gym, or maybe they want to lose extra pounds, but because of whatever's going on in their body already hurting, they don't do it. And so I just really wanted them to be encouraged that, if you find a good physical therapist, or if you go to our techniques, you can get yourself in a position where you're starting to be able to do the things that you ultimately are trying to do with your body. Yeah. So the last thing I kind of wanted to talk about is the fear of jumping back in. So for me, after an injury, it's a little traumatizing. You find yourself laid up on the floor somewhere, or in my case, so I've had several things that have triggered my herniated disc and things that I didn't do anything wrong, like intentionally. But the last time I was actually doing some bills and stuff, I had not worked out because I was stressed out from school. And I was just like doing papers, always at the computer, always typing, reading, or whatever. And I had not been stretching. I had not been paying attention to those signs, and just popping my leave. And I was paying bills, and that can be stressful too. You're trying to pay bills, so I'm paying my bill early in the morning. I had rose up early in the morning trying to take care of this, and I went to get up and I did a stretch, and I fell to the floor. So I went to the doctor, did all that stuff or whatever, ended up in physical therapy. And then it was time to go. So I was out of so my to-go for exercise is Zumba. And I was out of Zumba for 4 months, 3 to 4 months. And when I went back, when I started feeling better, I realized that I had developed a fear of getting hurt again. I went back, I had the stomach, the back brace on. My outfit, the back brace, 2 knee braces. That started hurting. Because when you have the sciatica, that nerve, that pain goes down your leg. And so my knee. I don't think I had an ankle thing on, but I was like all prepared, right? And so, Zumba, you're moving. I'm like this because I don't want to move anything. I'm scared, basically. I'm scared that something is going to come out of whack or out of place. What advice do you have for people like dealing with the fear of injury again and maybe keeping them from exercising or doing anything?
Well, for one, I try to get people, particularly during their sessions, to try to start doing some moves that mimic whatever it is they enjoy, whether it's Zumba, football, basketball, soccer, whatever. Try to get them to do some moves that mimic some of the things they'd be doing, even increasing the speed. And I usually tell people, particularly while they're still going to physical therapy on a consistent basis, to start going back to your activity. So if it's Zumba, start going back to classes just to see, because I mean, you'd rather be feeling great, go to Zumba and like, okay, wait, ow, I heard something. Let me go back to therapy, figure out what's going on, versus, okay, I'm done with therapy, felt great. And then you go to Zumba, now it's like, crap, now I got to go back and do this all over again and start from zero, as opposed to, all right, we're still working on it. All right, you have therapy on Tuesday. Is there a Zumba class Monday? Can you fit something in there? But beyond that, I mean, the mental aspect is very difficult. I mean, that's one of those things, particularly when I'm dealing with some of the young guys and like the ACL repairs, that is a big deal, because it's that concept of, yeah, I just got hurt. I don't want to get hurt again, but I really want to play. So it's finding that happy medium and kind of, talking to yourself like, I'm good. I'm okay. It's fine. Just kind of taking that moment, like, again, take a beat, talk to yourself, get yourself ready, and just go out there and do it. Try to wipe that fear out of your mind, because sometimes having that fear will force you to get hurt again. It's as strange as it sounds. Sometimes just that little bit of doubt will cause you to misstep, or you're thinking too much about it. And, you're in a step class, you miss a step by accident or something. That, that one thing that is kind of like, if I wasn't thinking about it, I would have been fine.
So can you tell us what the ACL is?
Oh, okay. The ACL is that's the anterior cruciate ligament. It is a very small ligament that is between your knee, right? And I do mean right in the middle. So it stops your knee from rolling forward on to nothing, if you will, from rolling forward. So it's that little ligament that kind of stops it. So a lot of football players tend to tear their ACLs. Soccer players tend to tear their ACLs. Women, unfortunately, are more predisposed to tearing our ACLs, particularly during those hormonal times of the month. And also due to just the shape of our bodies in general. During those hormonal times, our ligaments become extremely lax, even more so than they typically are, just in terms of the gender differences. And as well, the fact that women, we tend to be shaped a little more V-like from the hips down to the knee. And just that angle change also causes us to be a little more predisposed to tearing that ACL ligament.
Oh, wow. So that's interesting to know that your body. So what tips would you give us just as like rule of thumb? I know you were talking, and maybe we can go over them again. You were talking about like sitting at the computer for a long time, or just sitting in general for a long time. What tips would you give us to help us keep, I guess, is the agility in our body, or to keep to kind of prevent ourselves from maybe being predisposed to some injuries?
Honestly, particularly for those that work desk jobs, students, people that are sitting all day, try not to. And it's strange as that sounds. Every 15, 20 minutes or so, get up, do a stretch, just move, take a minute, back away from the computer. Those cell phones, stop doing this, bring them up to your face. As strange as it looks, it will protect your neck. They have this thing, they call it tech neck now, where everyone's head is like here, and it's really uncomfortable. It's uncomfortable to look at, and I'm sure it's uncomfortable to feel as well, because there's a lot of, as our heads probably don't seem that large in comparison to our bodies, but it's a lot of weight. And if you start to force that weight forward and forward and forward so that your ears are way in front of your shoulders, you're putting a lot of force on your neck. And in turn, you're taking that large space of all the nerves and vessels that have to come out into your arms, and you're just shutting down the space. So you may start to get tingling and numbness and things of that sort. So you want to make sure posture. Take a beat, get up, take a rest, take a walk break, go to the bathroom, whatever, just to realign your posture and get your body ready for the next thing you have to do. And listen to your body.
Yeah, listen to your body. I think that's my number one takeaway. I'm so glad I've been doing it. But I've been forced. I've been forced because I'm like, I am not crazy. Okay? When the weather changed, I know it's about to rain. I know it's about to snow. I know something is about to happen and I need to stretch. But I agree with you. I think definitely we have to be the masters of our body, right? So I think we have to, you know, and that plays a part in like what we're eating, what we're doing with it, and just really paying attention to those signs and those things and making sure that we're setting ourselves up for success, to be able to function at the best quality of life that we possibly can. And so I'm grateful. I'm thankful that you took the time to talk with us about some of these things and some of these tips and things that we can really do to begin to get ourselves in that better place, right? The thing that I always talk about is, you know, us being the best versions of ourselves. And so not just mentally, not just professionally, but also physically and spiritually being the best version of who we are. Because like you said, we only get one us.
Only one.
One us. So Aaliyah, tell us, for those who might be interested in reaching out to you or finding out more information about your facility, can you give us your information? And also, I know you have like, you guys do a lot of things with like football camps and things like that. Just tell us a little bit more about the things that you guys offer there.
Well, again, we're Our Technique Physical Therapy and Sports Performance. We're located at 655 St. George's Avenue, Roselle, New Jersey. Our phone number is 908-671-TECH, TECH. That's 8324. We have, again, physical therapy, sports performance. We have a step class that occurs on Wednesday nights. We also have a 7-on-7 football team that just actually had its first tournament and did pretty good. We also offer quite a few other just programs, if you will. We like to work with, again, athletes, number one, but we also offer personal training services for those whether they're just trying to lose weight, tone up, gain weight. We've had some guys that are trying to get, you know, go into the academy and need to pass that physical fitness test. And I think that's really about it for me.
Well, Aaliyah, thank you, Dr. Aaliyah. Let me not forget your title, Dr. Aaliyah. Thank you so much for taking the time to share your information. I just want to attest to my experience there. I think it's an awesome opportunity for a female entrepreneur to be doing something that she enjoys. I know it's you and your husband, so you guys have a couple entrepreneurship going on. And I love the duo because you're able to get your training, get your workout, and then you're also able to find out that physical aspect of yourself and therapy. So you can even come in starting out with therapy and then move on to personal training, or vice versa. So I am really thankful for you coming on. Thank you, thank you, thank you. And if you guys have any questions for her, please feel free to reach out to her. And you guys have an IG page, right?
Yes, that is R_technique_.
Yes, R_technique_. So you guys go out there, follow them, check them out. And I hope that this video has been helpful to you and it has encouraged you to continue to go out there. You know, we have injuries, we have things that happen to us all the time. But the thing that is most important is what you do going forward, right? So we're all going to have challenges, whether it's physical, whether it's mental, whether it's, you know, situational. We're all going to have challenges, but we have to begin to take charge of those things and not let them take charge of us.
Absolutely.
Yep. So thank you guys. And as always, when passion meets purpose, great things happen. Talk to you later.